Senator Merkley.
Thank you, Madam Chair. Mr. Troutman, my colleague from California asked the question of whether there are communities that have higher risks, and you didn't choose to answer the question, but it's such a simple point that we know the cancer rates are higher in study after study around certain facilities, petrochemical facilities, chemical facilities. I just encourage you to just do the easy thing and say, when a simple question is asked and there's simple, clear facts, just say yes instead of doing a kind of a big circular bureaucratic journey around the question. I did appreciate talking to you about the opportunity to do good things for America in this role of chemical safety and pollution prevention. We have all kinds of chemicals that we have lots of studies on that are causing harm. That was really highlighted by the MAHA study done in May and then reaccentuated in September, Make America Healthy Again. And it laid out in that report the risks associated with plastics and with PFAS and with ag chemicals. And it also noted that often the studies that come from the industry are often very biased compared to the rest. I thought that was a healthy, fresh air about just being honest about the challenges we face for American health. On the plastics front, the MAHA report says microplastics, one study in 2025 shows the concentration found in Americans' brain tissue increased by 50% between 2016 and 2024. As we've been able to measure micro and nanoplastics, we're finding more and more contamination inside of our bodies. And it noted that those plastics have endocrine disrupting chemicals that interfere with hormonal development, trigger early puberty, especially in girls, and heightens the risk of obesity, infertility, and hormone-related cancers. I appreciate that type of just honesty about the challenges we're facing. We have chemicals that do amazing things, but there are also effects on human health. So let's just face that honestly and wrestle with how do we maximize the good and minimize the harm that comes from that. On the plastics front, both the chemicals, plastics themselves, and the additives are endocrine disruptors. And that's certainly a big, significant contributor to the challenges we face in public health. So we heard from my colleagues, like the mission of just accelerating the approval of chemicals. But we know a lot of chemicals that have been approved are also having health-related consequences. How are you going to use your position to help support the MAHA movement and try to figure out how we can minimize uses or applications in the plastics world? And plastics do a lot of amazing things. I'm not saying we're banned plastics, just saying that when they get into the environment and degrade and get consumed by us humans, then there's a risk factor. How do we try to figure out how to minimize that harm?
Senator, I appreciated the conversation we had in the time we had to meet, and learning more about where your concerns and interests are with regard to the plastics matter. And a couple thoughts there with regard to the plastics and microplastics matter at the agency. The administrator and across the program offices recognize the microplastics matters and plastics-related interests there with regard to the science and protecting human health and the environment, and is committed to using all the program resources to continue to look at that across the programs that are within the Environmental Protection Agency. And as the administrator is committed, and I do as well, we are working collaboratively across the federal family to ensure that children in our environment are protected with regard to where the MAHA report and the strategy is. We have, as the administrators remarked, and I am learning in my briefings, there are pro-growth policies and collaborations with the private sector to advance research and drive innovation to increase public health awareness and address and understand where some of these critical issues are. So those are some of the commitments that I am happy to talk about here with you today. And
well, I do hope you'll pursue that, because you'll be under constant pressure just simply accelerate approval of chemicals and diminish actually doing anything about the harmful chemicals we have. You and I also talked about PFAS and how every nonstick pan, and consumers don't even know where it is. You get the microwave popcorn, you don't know if PFAS is on it. You get the frozen food that I eat every night, and it's on a cardboard container. I have no idea if it's been sprayed with PFAS. Can't we at least warn consumers about where this stuff is so that there's an incentive for the industry to say, if consumers don't want this stuff, well, they should know and we'll get alternatives. And I cited to you the example of growth hormone in milk, that the way that it was eliminated was because when people had small kids like we did, we sought out the milk at the one place we could buy it that didn't have growth hormone, and so did lots of other parents, and pretty soon the dairy industry chose to say, well, we're going to respond to that and collectively not use it. And so do you support at least labeling for us to be able to know, Americans to know when they're coming in contact with these PFAS chemicals that have innumerable studies related to immune suppression, decreased fertility, and cancer risk?
Senator, I appreciate the question and the discussion. And as you and I discussed, the administrator has announced earlier this year a strategy across the agency for PFAS, and where the program office can, within chemical safety and pollution prevention, can help to advance that strategy and address some of these issues. The program office will do so.
Thank you for the extra time, Chairman, and I'll give some follow-up for the record on the other chemicals I'm concerned about, but I do hope the strategy is simply not the strategy of doing nothing, because that's kind of what I'm expecting, and I'd love for you to surprise us. Thanks.
Thank you. Before I turn it over to Senator Blunt Rochester, I would like to ask for unanimous consent to submit various records, letters of support for both nominees without objection. So